Hi, I'm Lynn Antonopoulos reporting for Daily Bulletin. I'm talking with Dr. Brandon Koo, a diagnostic radiologist resident in training, working with the Brown Radiology Chest Imaging Department in Providence, Rhode Island. He is sharing key learnings from his RSNA 2024 session, Recreational Drug-Induced Lung Injury. Thank you for joining me today.
Thank you for having me.
Dr. Koo, what are some of the most current epidemiological trends in recreational drug use?
That's a great question. What we're seeing increasingly in the past several years and past decade is that recreational drug-induced lung injury has really taken off. This has been in part due to the increase in the use of synthetic opioid use, particularly starting in 2016 or so. This has really contributed to an increase in the number of patients presenting to the emergency department with recreational drug-induced lung injury. We're also seeing a worrying trend in younger patients, young adults, and teenagers, particularly in the field of inhalational drug-induced lung injury. While we're seeing an overall decline in traditional cigarette smoking in these patient populations, we are seeing that gap be filled with e-cigarettes, marijuana, and vaping. And those have their own host of lung-related injury patterns that we should be aware of.
And why is it important for radiologists to be aware of the imaging techniques and findings on recreational drug-induced lung injury?
So the whole point of our educational exhibit was to really highlight both the acute and chronic findings associated with recreational drug-induced lung injury. And these manifestations are as varied as the types of substances that can be used, and there are quite a number of them. But what we really wanted to do was create kind of a baseline index for radiologists to be aware of. And more and more what we're seeing is radiologists are working in the ED setting, and a lot of these patients come in undifferentiated, and what this educational exhibit will do is set a baseline knowledge. It'll also be helpful for radiologists working in the outpatient setting who can pick up on more chronic findings of recreational substance-induced lung injury and suggest a diagnosis so that patients can get paired up with the resources they need, not just in the acute setting, but also once they're discharged back in the community, so that they can get help with substance cessation.
And can you talk about some of the unique challenges associated with imaging this particular patient population?
So I would say the main challenge that we face is trying to suggest these diagnoses with incomplete patient history. And that can be either due to the fact that patients coming into the ED with recreational substance-induced lung injury, a lot of the times, they're either too sick or they're presenting too acutely to fully participate in the patient interview. We're not getting the full history when we're trying to evaluate these patients' imaging. So it's kind of up to us to play the part of a detective, kind of piece the imaging findings together to try to reach this diagnosis. And even when this vulnerable patient population is able to participate fully in a patient interview, due to the general stigma surrounding recreational substance use in this country, unfortunately, a lot of times patients may not be able to be as forthcoming as they want to when discussing these issues, and it's really up to us as radiologists, but also as clinicians, to try to suggest these diagnoses as sensitively as possible, so that we get these patients the care they need.
That's great. Thank you for your time today. For more information about the study, look for this RSNA 2024 session on demand at rsna.org/meetingcentral. And as always, you can find more radiology news at rsna.org/bulletin.